guest, Dr. Mui Aino, who is the Executive Director of the National Primary Healthcare Development Agency. Dr. Mui, good morning and thank you very much for your time. I really appreciate this because we eventually got to talk to you in Cervical Cancer Month.
Good morning, Dr. Eja. I'm hoping that you and the viewers can hear me clearly.
We can hear you and we can see you. Thank you.
Fantastic.
Awesome. So let's go. This month is Cervical Cancer Awareness Month. There are lots of awareness activities online and in person across Nigeria, and I'm going to take this opportunity to appeal to all Nigerians across the country. Please take some time, find out what's going on, and help us change the narrative of cancer care in Nigeria. Together we fight, together we win. Now I'm going to give a brief introduction of who Dr. Muri Aino is. He is a special health leader and an executive. Dr. Mui brings over 25 years of national and international experience in human development, healthcare leadership, and executive management. He has vast experience designing and implementing transformative public health programs and inventions, supporting primary health development, correct, primary healthcare financing, immunization, nutrition, HIV, AIDS, MNCH. I don't know what that is. For a strange reason, I don't know. I didn't check that. Disease eradication, global health security, health systems, leadership, and innovation. Good morning, sir. And thank you very much once again for taking time out. And to all our viewers, thank you once again for joining us. Now we're going to have a very fantastic conversation. So let's sit back and listen to what Dr. Mui has to say to us as nationals, as citizens of the Federal Republic of Nigeria. Dr. Mui, it's time for us to have our good chats.
Absolutely.
Awesome. Now, please, can I just ask you a question? Because this is one thing. Learning, education, you learn every day. What is MNCH?
MNCH, maternal, neonatal, and child health.
I'm very glad I'm not the one that had to say those words. So let's go.
It's basically the health, has to do with the health of mothers, newborns, and young children.
Thank you. So, viewers, we've learned a new one now. We keep learning every time, and it's very, very nice to have different professionals tell us about the things we just take for granted. So, let's start with the first question. It would be very great for our viewers, firstly, and I think you would appreciate that, to get a general overview of what actually the National Primary Healthcare Development Agency does and how to access your key services. Because from conversation, a lot of us, I think the majority who should be able to access it can access but don't know what is available. So they're within the limited knowledge. And it'd be nice for you to share that with us.
Thank you very much. So the National Primary Healthcare Development Agency is that arm of the Federal Ministry of Health that is charged with the development of what we call primary healthcare services across the country. So that really means working with the states who are responsible for the actual service delivery to make primary health centers available that work, where Nigerians can go and get basic services to what we were saying before. Mothers, pregnant women, you want to attend antenatal care, delivery services, you want to take care of your newborn, you want to take care of your babies, immunization, preventive services, and diagnostic services and basic services, but at the primary care level, most of which don't include things like surgery. What we are we'll speak about this, I believe, a bit later, but, those primary health centers are then plugged into more advanced facilities that are not far from them for referral for those conditions that the PHCs or primary health centers cannot handle. So everything from defining the standards for primary health care, the guidelines, the policies, the SOPs, developing the workforce, or at least creating a framework for the development of the workforce that will work in the front lines, things around managing the commodities, so meaning the medicines and tools and basic devices that you need to provide primary healthcare services. Some of the data management and all of that is really what the Primary Healthcare Development Agency is about. Thank you.
Thank you. Thank you very much. I think that's one of the first things that a lot of us don't even realize when you said it just now. It hits the PHC. A lot of us hear the word PHC when medics talk, and we don't really know what it means. And for the first time I heard you say it, I was like, oh wow, is that what they're talking about? So, as a cancer patient and an advocate, the Universal Health Coverage Program has become something of very serious concern, because it is essentially important to ensure we have equitable access of care across the country. And cancer currently globally is 1 in 2. So we are now in a position where we start to think about everything and how. And so all essential healthcare services across Nigeria, focusing on ensuring on the HPV is accessible. What's the plan? How is that going to work? How are you going to be able to deliver on this? Because it's 1 in 2 globally, and Nigeria is 80 to 90% that get it can't get access.
Yeah, you're referring to the human papillomavirus vaccine, correct?
Yes, but then we have to look at it in relation to the universal health coverage.
Yes. Yes. So it's a number of things. Just starting with the tenet of the universal health coverage. You see, one of the priorities of the government of President Bola Ahmed Tinubu is exactly that, universal health coverage, to make healthcare available in an equitable way, but also just not healthcare, but quality healthcare for every Nigerian, regardless of where they are. So, as you are aware, the President and the Coordinating Minister for Health and Social Welfare have launched something called the Nigeria Health Sector Renewal Investment Program, which strives to do that for primary, secondary, and tertiary care, really strengthening our systems, really better coordinating the resources that is going into healthcare. Because one of the things that has happened before now is that there's not enough money. We're not spending enough on health at all, if you look at the per capita spend and what the standard should be. But we are spending quite a bit. So a big part of the problem is that what we are spending, we have not historically seen commensurate benefits. And because it's a big country, in fact, 37 mini countries within a country, frankly, that really can be attributable, at least in part, to inadequate coordination and focusing of the effort so that you can start to see the results. And that's what the government is trying to do now. So as part of that, in the primary healthcare level, what we are doing is there are, about 8,300 primary health centers right now that are funded directly, from the federal government. In their operations, they get money every 3 months through something called the Basic Healthcare Provision Funds. So what we're going to be doing is a couple of things over the next 4 years to make sure that we achieve universal health coverage. One is to make sure that, as many of them as we can get to a point that we define as full functionality, which means that they're not just there as primary health centers, but they have the infrastructure, they have the staff, the nurses, the midwives, the healthcare providers. They have the commodities, the medicines, and the tools that they need. They have the money that they need for operations to pay their electricity bill and water bill and run the place, and the flexibility to hire ad hoc staff. So what we find right now is a lot of our facilities are not there. So we're going to be really pushing, to get the facilities at the primary healthcare center to that level. Now, getting to HPV vaccination specifically, we were fortunate that, in fact, my first official activity on duty on day 2 was to formally introduce the human papillomavirus vaccine to Nigeria's routine immunization program. Hitherto, the vaccine was available, but on the private sector, and very expensive. But right now, in the first phase states, there were 15 states and the FCT that were in the first phase, all of whom have now introduced the HPV vaccine into their routine program, which means that, our adolescent girls, young girls, can walk into any public sector facility and should get the HPV vaccine free of charge. Now, and the plan, of course, the first half of this year, May precisely, we're preparing, really gearing up towards that now, is to introduce this vaccine in the remaining 21 states across the country so that every Nigerian, wherever they are, will be able to access the HPV vaccine. Because, and this is phenomenal, because what that means is at least when our young girls get it, they are free from one risk. There are many risks that people face as we grow up, but they then don't have to worry about the risk of developing cervical cancer. Now, we know that cervical cancer alone, to your earlier point, kills almost 8,000 people in Nigeria annually now. So that's what we want to try to prevent and attack. So that's where we are. I'm also aware that as part of the broader strategy of the coordinating minister, he's also, mobilizing the resources and the partnerships to set up world-class regional cancer diagnosis and treatment centers across the country. I believe there are about 6 of them that will be set up so that, all of the different kinds of cancer, not just cervical cancer now, can be diagnosed, but also can be treated. You don't have to go to India or Egypt or the US or Dubai. You can get the treatment and care that you need in Nigeria here. Let me pause there.
I like a lot of things you said this morning. I'm feeling very happy now. Now I'm going to be going through how are we going to feel we can access this now. We've heard about the rollout, and we've rollouts have gone, and we're supposed to, from the original plan, there's supposed to be phased discussions on phased implementations. Are we still on track for that?
Absolutely, we are on track.
And numbers?
Yes. So we actually, so for the first wave states, based on the estimation that we did, we were targeting about 6.5 million girls, and I think we're about 80% there even now, in terms of the number of girls that we have reached. So that's not bad enough if you especially consider 2 factors. One is that we're right now trying to rebuild our routine immunization program so that, our routine coverage is not even at that level for any of the vaccines yet. But also the population that this targets, which is teenagers, is the population that we didn't have a lot of experience reaching them with any interventions or services. So this is the first time really that we're in a systematic way. Of course, there are programs, adolescent health programs, HIV programs that target teenagers. But if you think about the health system as a whole, I think we're now learning how to engage with teenage girls who, I have 2 teenage girls myself, that are my daughters. And I'm sure you will agree with me that they are an interesting demographic to manage. So I would say we are
awesome. Thank you.
And like I said, in May we're getting set, to roll out to the remaining states, getting the vaccines in place, getting the health workers trained, getting the tools in place, and make sure that it's a seamless introduction. We also learned a lot of lessons. So even though we consider the first phase very successful, it wasn't perfect. We learned a lot of lessons. There was initial pushback and negative campaigns against the vaccines, and now we're being a bit more thoughtful and proactive to prevent those, or at least be a lot more ready to get on them and respond to them when they do happen. Yeah.
Yeah. Thank you. I think you've now answered, because I think a lot of people don't realize that the cervical vaccine, the HPV vaccine, is one of the best tools to help us reduce the cancer burden across Nigeria. And like you said, and I always say to people, my children have had it, so I don't really know what it is. And it was very interesting when my daughter said to me, "Mommy, the statistics is now showing that 100% of those who had it with me in the first batch, none of us have ever had, and none of us are deemed to be ever going to be at risk of this." So I think the public need to know that we're not talking about it because people just want to talk about it, but the vaccine may just be a very good starting point for us as a country. So let me ask the next question, and it is to do with the plans for the agency for World Cancer Day. It's about, so I think it's about next week, something like that. So what are the plans so that we can all know how to participate in your plans?
Thank you very much. So the agency's engagement with cancer will include the World Cancer Day, but Cancer Awareness Day, but also it's broader, right? So I think in terms of how we're building the system, it's also trying to mainstream cancer awareness and prevention and screening, even at the primary healthcare level, is really the direction that we're going more broadly. That's a bit more substantive in terms of the impact it can have. But for the day itself, what we will do is what we typically do, which is we would have a walk, which will be well publicized, and cancer awareness walk that people all over Abuja and some of our zonal office locations, will be invited to join and participate in. We will also be working with our partners, our media partners, to do quite a bit of awareness campaigns, especially as regards the planned introduction of the human papillomavirus vaccine in the remaining 21 states, like I mentioned, but also just addressing cancer more broadly. But like I said, ultimately, what we're trying to do now is better mainstream cancer prevention and screening, into our primary healthcare services across all of these thousands of PHCs that I referred to earlier. Thank you.
Thank you. You just helped me to go through quite a few things. There's something that keeps coming up that I wanted you to help us to talk to the public on, and that is to do with I think it's called the Federal Medical Centers. A lot of cancer advocates are engaged in giving out, supporting those of us that live with the disease in our everyday living. And a few observations came up over the last Christmas across various NGOs. And one of the ones that really hit me, which I thought, oh, let me just ask you if the commission will look at it, if the agency will look at it, is the citing of the FMCs. I think that's under this. It's under the agency. FMCs, because one of them was found to be sited next to a mortuary. Not a mortuary, a cancer center. Yes, a cancer center was in the same building as a mortuary. That's it, two of them in a building. And a lot of people said, oh, Denise, do you know that one of the cancer centers are located next to a mortuary? So are you guys already campaigning for that? I thought, oh my goodness. So I'll ask you if there's going to be a look at the exact locations of all this to be able to encourage cancer patients to not give up this fight.
Thank you very much, Dr. Dennis, for asking these questions. A number of clarifications, and then I will speak to your question. So the federal medical centers and the tertiary care centers or cancer care centers are not under the National Primary Healthcare Development Agency. The National Primary Healthcare Development Agency works with states to provide services at the primary health center level. Now, that said, we are part of the health ecosystem and under the Federal Ministry of Health. So we are quite plugged into the activities of the health system, because the human being, the Nigerian, is one person. Whether you need primary health services or you need secondary health services or you need cancer screening and care, you are one person. And as a health sector, we have the responsibility to provide you access to that. So we try to work in a coordinated and integrated way. So while I am not specifically aware of this instance where a cancer center is sited right next to a mortuary, and I would appreciate if you can share the information with me or others.
I will.
Pass it on. I am aware that the Federal Ministry of Health, led by the coordinating Minister for Health and Social Welfare, Professor Mohammed Ali Pate, and the Minister of State for Health, Dr. Tunji Alausa, they take very, very seriously, the quality of health services that are being provided, both at the primary but also at the secondary and tertiary levels. So this, I'm aware of instances where complaints have gotten to the Ministry of Health, and the ministers get on it personally and see to a resolution that is very prompt, but also very sustainable for the health system. So I'm aware, I'm assuring you that when this information gets to them, they're going to act on it and do what is right. Whether sometimes there is misinformation, as you are aware. So sometimes someone isn't understanding what is really going on, but many times, in fact, there's some sort of infraction, that need to be corrected. And what I have seen is that the coordinating minister and minister of state get right on it, and they solve it as part of the agenda of President Tinubu's renewed hope agenda. The ministers are really driving a renewed health agenda, trying to, one, provide the quality of health services to Nigerians, but also building the trust, listening to Nigerians, hearing from you. We are hearing, and we are responding in a way that wants to rebuild the trust of Nigerians in the health system. So please get the information to me, and I will be sure to personally take it up and make sure somebody responds to it.
I believe you will, and I want to say thank you, because this just came up while we were talking. I thought, you know what, let me just ask. Sometimes it's best to ask than to let the world continue to give wrong narratives and not recognize the work that a lot of people have put into helping us. I always feel, because I live with the disease, helping us that have the disease to at least have access. I'm going to ask you one question, and this one is, can you give me 3 takes that we as citizens of Nigeria can look forward to in 2024? And I have a big smile on my face, and I'm hoping you're going to give me some of the ones I'm looking forward to.
So I will tell you, thank you very much. Good question. So excuse me, the coordinating minister articulated a strategy for the health sector. I will give you a little bit of context, and then I will answer your question specifically. That really is targeted at saving lives and reducing pain, both physical and financial pain, and producing health for all Nigerians. So what that basically means is that for those conditions that are really affecting the lives of Nigerians, making us sick and killing us, so be it cancer, be it maternal mortality, women dying at childbirth, be it vaccine preventable diseases that are killing our children, we're tackling them more head on this year. So what Nigerians will see is that at the primary healthcare level, at the secondary healthcare level, at the tertiary healthcare level, we are making services more available, but also at costs that are affordable, where they are not even free at all. For primary healthcare, they will be completely free, but for some of the more advanced care, there may be some associated out-of-pocket costs. So we're working in sync across all the agencies of the government to make that more available. So at the primary healthcare level, what that looks like is you find primary health centers that work near you. Everybody knows a primary health center or two. The real problem is that you don't really trust them enough to go there to access your services. So we want to reverse that. So that's one thing that you can look up to. The other thing that you can look forward to, okay, is that there is a lot of interventions. The honorable ministers are hearing the voice of Nigeria around the cost of medications. So, because of a lot of changes in our economy, in our currency, but also exits of some of the companies, there is a lot of effort now to really engender local manufacturing of medicines that are quality assured, that one, basically guarantee our supply chain. As we also in the times of COVID, when push comes to shove, countries will take care of themselves and their citizens first. So even just our reliance on importing most of what we need, at least for healthcare, which is critical, that's not really a good place to be. So there's a deliberate strategy now, by the government to improve local manufacturing and ultimately lower the price of medicine. In the short term, there are negotiations and efforts through pooled procurement and other market shaping interventions to immediately lower costs to make things more affordable for Nigerians. Of course, we are also going to, speaking for my sister agency, the National Health Insurance Authority now, we're also going to be looking to drive up the coverage of health insurance amongst Nigerians. One of the problems of health Nigerians is that we kind of believe we're not going to be sick, but then every now and then we get sick, and when we get sick, there are catastrophic associated costs because they tend to cost a lot. But if we are insured, a lot of that risk of catastrophe is taken away. And really underlying all of that is that we are going to be paying a lot of attention to the voice of Nigerians. At every level, we're going to open channels of communication to give us feedback and tell us how we're doing. But also, when I tell you that the primary health center is working in so and so place, we will be very transparent. Say, at least in these 10 places, if you go there, the PHC should be working. When you go and it's not there, you will have a number that you can call, to speak to. So those are some of the things that you can expect going forward.
I want to say a very, very big thank you to you for actually taking time out to talk, because you've actually put a smile on my face. This is January, and whenever I have this particular discussion, it helps to form the conversation for 2024. And hopefully, I will be in touch with you on different things as we go along. But I want to say very, very big thank you on behalf of all of us for taking your time out to be with us this morning.
Thank you very much, Dr. Rachel. It's really my pleasure to be.
Thank you all for joining us this morning, and we give a special thanks to our guest speaker who has really given us a lot of information, and I hope that all of you will find information. You can follow us on Common Cancer Foundation, share, subscribe, and click on the notification buttons to get whatever information you want. You'll be able to find this information on our YouTube channel later today or tomorrow for you to be able to look at what has been going on and what was said, and take it and use it for your own planning. Follow us on Instagram, Facebook, Threads, and LinkedIn. We look forward to engaging with you again. World Cancer Day is next week, and trust me, the page is filling up already. So all of you in the space, share your programs, and please go on to the web page for the national, or let me just call it as it is, because that's it, NPHCDA, because they have a lot of information on their page. Please go and look at it, and you'll be able to find answers to a lot of your questions. Together we fight, together we win. Thank you for joining us this morning.
Thank you very much. Logging off.
I really appreciate. Yes, and I will send a message to you of where we found it, because we should have come off now. Yeah, and I'll send it to you. Thank you, sir, for joining me. Thank you.
All right, we actually wanted to engage
absolutely Dr. Dennis,
Dr. Ejo a bit, if she's still there. Dr. Ejo, thank you so much for all the information out there with
absolutely
our guests, talking about
human papillomavirus.
Yes, we can hear you if you're still there.
Okay. I wanted to speak to you about it because, this is something that is commonly, one of the most commonly sexually transmitted diseases. And a lot of people don't even know, symptoms to check out for. So knowing that the vaccine actually, is the first way of prevention is so key to this conversation. Thank you so much. Again, we wanted to ask issues about, for me, I wanted to know the relativity between mother and child transmission and even through nursing, because sometimes we get a lot of that conversation, and it was really key to know that even in antenatal, mothers can actually have access to these vaccines.
A lot of currently the rollout, we have to follow the process of what the Nigerian government is doing. It's very unfair to talk about things that they've already worked on, and they have a rollout program, and that program actually, to be fair even to Dr. Aino, is on the public space now. Okay. And everywhere you can find where to find the vaccines, you can find how to get a vaccine, but the current rollout is for 11 to 14-year-olds. However, the vaccine is free wherever it's available. And for people over, I think you would have to find out which centers actually provide it for free as well. but the rollout is available in Nigeria, and you can ask for help. So just search, just find out from the nearest center that is close to you where you can get it. It's in all the 16 states of the rollout now.
All right. Thank you so much. Quite informative and educative there, your discussion with your guests. Do have a great day, and thank you for all you do on the health.
Thank you all. Have a look.
So and so place. We will be very transparent. Say, at least in these 10 places, if you go there, the PhD should be working. When you go and it's not there, you